Okay, so good to have you back from that insert there. Remember, we just had a chat with those who are in the field to end the practice called female genital mutilation. And Atom just stepped out. Now, we'll be taking you to seeing the medical aspect of this practice. A whole lot would be unveiled in this particular segment as I have joining me on set Dr. Galma Mami Ian. She is from the Department of Obs and Gynecology, UCTH. Good morning, Dr. So good to have you join us.
Oh, good morning, Mr. Ian.
Yeah,
Nice to be here.
thank you so very much. It's indeed a pleasure to host you. And let's take this discourse further into the medical aspect. Uh, I think definitely almost all the institutions have their various way of defining FGM. But as a medical doctor, what would you really say, the concept FGM is?
Okay. FGM, that's female genital mutilation, can be defined as a gender based violence that involves any practice or any procedure that involves partial or complete removal of the external genitalia or injury to the external genitalia, which does not have any medical use. Okay, so the external genitalia would involve number one, the clitoris, the labia minora, and labia majora. So all this makes up the external genitalia. So
Okay, let's look at the types because before the light came on us, we had to look at the various types of FGM. Talk to us on that, doctor.
okay, there are basically four types of female genital mutilation. You have type 1. Type 1 involves excision of the clitoris, while type 2 involves the excision of clitoris plus the labia minora with or without the excision of the labia majora. Then for type 3, you have the excision of other parts of the female external genitalia, which will involve burning of the area using scraping of the external female genitalia. Then while in type 4, it involves some of the women actually suture. They sew those that's the labia major minora together. They sew it. They use all sorts of instrument inside the vaginal wall to actually narrow it. They put even very harmful substances into the vagina to narrow it. All these are parts or different types of female genital mutilation.
Now, you have some very big jargons there, medical
Yes,
jargons there, but
yes.
in very clear terms, is it that those several mutilations or what they are cutting out are not necessary to the woman's body?
They are not necessary. They're not necessary because number one, these people actually have this belief that if they do it can also be called female circumcision or female genital cutting. So they feel that when a woman is circumcised, she has the tendency of being more faithful to her partner. She enjoys sex more, and she has that tendency. She's more able to get married. Yes, and also she looks more feminine, okay, as compared to other females, which doesn't have any medical basis of use.
Okay, I was trying to find out also that cutting those parts out, is it
Yes.
that those parts are not needful to the woman's body?
That's what
That's the
they
direction.
feel that okay, cutting off the clitoris is known to be the most sensitive part of the
Other
woman's
woman, okay.
external genitalia. So during sexual intercourse, it helps to arouse her, makes her more receptive to the male partner. So cutting off that part, she doesn't have that reception of wanting to sleep with the male partner in per se to what
But
their
is that
beliefs are.
medically proven?
No, it's not medically proven. It's not medically proven. So that those are the problems that we encounter.
Let's look at it because, on one side, culture is trying to take preeminence over medicine now.
Yes.
Let's look at the series of complications this practice has
Okay.
put you guys, the doctors, into.
Okay. It
Because
should be known that more than 200 million girls have been circumcised
globally,
globally. Yes,
okay.
globally. So the complications will have the short-term complications and then the long-term complications. For short-term complications, you will have severe pains because these women they don't know anything about pain relief. They just cut off different parts of the external genitalia without even giving the patient the individual per se any drugs to relieve pain. Then the instruments are not are not sterilized, so she's at risk of having infections that can affect her reproductive system. Okay, then they're also at risk of having tetanus. As I said earlier, that they put all sort of harmful things into the vaginal wall, which can make her come down with what you call tetanus. So for the long term complications, you would have, for sexual complications, the woman will have what we call dyspareunia. She has pains when she sleeps with her partners. Then there's no satisfaction, because most times these women cut off, as I said earlier, they cut off the labia minora, and here you have the Bartholin cyst. Bartholin cyst is what lubricates the vagina during sexual activity. So if that's not there is no lubrication, the woman does not enjoy sex. She has a dissatisfaction during sexual activities. Also, it has led to so many divorce cases, because if the woman is not able to satisfy her partner because she's not actually enjoying the sexual activities, then it's most times it leads to divorce in the homes and also separation. So other complications that could arise are psychological complications. The woman becomes depressed because she didn't willingly allow them to do this to her. She was being forced to do it. So she becomes depressed. There are anxiety disorders and so many other things could arise. You also have chronic pelvic pain, because most times these women, they don't even know any anatomy of the external genitalia. So they cut off so many nerves, cut off so many blood supplies to the external genitalia. So the woman ends up having chronic pelvic pain for a very long time. Also, risk of pelvic inflammatory disease, which is infection that can arise from using unsterilized equipment. And also during obstetric, also we have obstetric complications, which would include prolonged labor. Because when the vaginal wall is so tight, the baby can hardly come out during labor. So she's at risk of cesarean section and all the complications that can arise for surgery. So she's also at risk of what we call hemorrhage, postpartum hemorrhage during birth delivery, because of how tight the vaginal wall is. She ends up having perineal tears that could end up that could make her end up with bleeding, excessive bleeding. And when she has that, she might go into shock. When she goes into shock, what happens? The kidneys the kidneys might shut down. From there, other major organs in the body also shuts down, and that leads to death. And also during that process, some of the women sew up what you call the urethra. Urethra is where urine comes out from. So when you sew up that urethra and urine comes out from there, and she's not able to urinate, what you have is urinary retention, incontinence. She can't urinate well, and this also has so many other complications. These are just a few that I've mentioned.
And all because of female genital mutilation.
Yes, all because of female genital mutilation.
Let's look at FGM in the middle of COVID 19. We are in a pandemic. So, uh, those who do this practice, some could even, their hands are not washed, so to say.
Yes, the hands are not washed.
And
The instruments are not sterilized.
yes,
The environment is not healthy. Whatever they use in putting into the vaginal and even sewing up some parts of the external genitalia, it's not being sterilized. So this woman are at risk of even COVID-19 and other things that could arise from COVID-19 complications. So
I'd love you to bring
that's
us
it.
up with speed with the statistics on FGM. Just give us the statistics again.
Okay, I said over 200 million young ladies have been circumcised, and they've recorded as World Health Organization has recorded more than 2,000 deaths from female genital mutilation, and it's practiced in so many African countries, in North America, in South America, in Asian countries. So many places are still practicing this very abominable act.
Doctor, let me find out. This FGM, does it all, can it lead to VVF?
Yes, it can lead to fistula formation, because you don't know what part of the body they are cutting off. It has so many complications, so many. It can lead to vesicovaginal fistula, that's an abnormal communication between the bladder and the vagina, even between the rectum and the vagina, and the woman starts leaking feces. So many things can arise from it. It's very dangerous.
Very, very
Very
dangerous. So,
dangerous.
would there be any way out? What's the helpline, so to say?
Okay, the helpline number one, we have the Well Women Clinic, which runs every second Wednesday of the month, where we see women with different challenges, with different concerns. We do also breast cancer screening, cervical cancer screening for these women. And we also see women that have complications that may have arisen from female genital mutilation. So the clinic, it's at second and number two more road, and we usually hold it. It holds every second Wednesday of the month. Yes.
Doctor, I would love to get your parting shot, your medical advice to every mother watching this, every father watching this, and that girl child watching this who would love to get themselves involved in mutilating their female genitals.
Okay, and I would also, so I forgot to mention, we also have a helpline in case you don't have anyone to talk to and you want to actually talk to somebody that can be of assistance to prevent this from occurring. We have our president's number, that's Dr. Vivian Lutu. Number is 08065153097.
Can you take that number again, please?
08065153097.
Okay, so let's
Yes.
get your medical advice now to those watching us.
Okay, the medical advice is that number one, the prevention of female genital mutilation will start from the communities. Number one, we have to go to the communities, enlighten these people on what female genital mutilation is, on the complications that can arise from it, so that they are aware and they can take informed decision on not partake in this act. And we also have to go and meet the women that get involved, as the traditional circumcisers that are involved, to stop them from doing it, to have to put a ban. And also the media. Yes, the media is also very beneficial. The social media, that's Twitter and Instagram, Facebook, and also this, as I'm here, this news stations will help to enlighten these women. And also policies can be made to ban female genital mutilation because it has caused very, very dangerous things for women.
Dr. Galma Mamiyan,
Yes.
thank you so very much from the Department of Obs and Gynecology. Thank you for
It's
your
a
time.
pleasure. It's a pleasure being. Thank you for having me.
Thank you. We'll still bring you back maybe to look at other issues around gynecology.
Okay.
It's a good morning, Cross River. Had a great time talking with Dr. Galma, and the media won't stop talking to ensure that there's an end to the practice of FGM in Cross River State. Stay with us. We're not done yet. Don't go away.